lived here since 2015, but I grew up in this area. I've been here my entire life. All my driving is for a local cannery for the most part. I do some independent stuff on my own. From time to time when it's slow for the cannery. We go out to the fields and get loaded with raw vegetables and produce and bring it back to the cannery. Back on October the 11th, I had a massive heart attack and spent several days in the hospital and ICU and had some casts and some stents put in. My wife walked in and realized I was unconscious. She called my mom, and my mom lives just down the road a little ways and not far at all. And my mom's a nurse, and she came and I was unconscious and no pulse. And my mom started CPR. Once EMS took over doing CPR, between here and the hospital, my pulse was lost 7 times.
Jason was completely unconscious. We did an extensive exam, and unfortunately, neurologically, he has no signs of life. We did another exam a few minutes later, and it's still the case. When we deal with cases like this, we have to make a very tough decision because, as we know, most patients like Jason do not survive. The survival rate is about 5 to 10% for any patient whose heart stopped outside the hospital. I took Jason to the heart catheterization lab. I knew one of the arteries is closed in the back of the heart from the ECG findings. One of the arteries was totally closed with the clots seen. I went and opened that artery, placed a few stents. He was overall stable at that time. We took him to the intensive care unit. We placed him on what we called therapeutic hypothermia protocol. The purpose is to decrease the metabolism of the body and try to save the brain if possible. A day after that, we tried to stop a lot of the sedatives that he was on, and Jason made an impressive recovery that surprised all of us.
Been going to cardiac rehab right there at MUSC. They monitor everything you do. When I go, I'm put on a heart monitor. The crazy thing is I'm actually pretty active. I was actually pretty active before I had the heart attack. So I mean, it's kind of like, it kind of caught me off guard. As Dr. Camus told me to my face, you know, I was a walking miracle. So you know, I'm thankful that he's had the training that he's had and the experience that he has, and that the good Lord gave him the ability to use his hands to save my life.